This one you do not want to miss. Today on the podcast, I have Dr. Erin Nance. She is an orthopedic surgeon and medical influencer who is known as the patron saint for medically gaslit women. Her TikTok account, at Little Misdiagnosed, has been viewed over 1 million times and been shared with over 1 million people. She is the co-founder and CEO of Feel Betr, a health-focused social media platform that curates personalized content for women with chronic illness. She is a badass, and I would like to think now one of my friends. So excited for you to hear this and hear all about this incredible new company that she is creating. Welcome back to Wellness as a Way of Life, the less is more source of wellness, knowledge, wisdom, and inspiration for modern women and female founders. Here, we teach you why not all wellness trends are for you, how to figure out which ones are, and how to best adapt them for your personal wellness toolbox. I'm your host, Megan Swan. With more than a decade of experience in the wellness industry and on my own personal journey, I will teach you how to tune into and trust your intuition and drown out all the noise. I love to support female founders in the process of building their business to strategically optimize their physical, mental, emotional, and spiritual wellness. I have helped hundreds of women establish wellness as a way of life with my less is more approach. Join me on my mission to make wellness a way of life. Let's dive in. Hi, Erin. Welcome to the podcast. I'm thrilled to have you here. How are you? We'll start there.
Hi, Megan. Thank you for having me. I'm so excited to speak to you and your listeners.
Yeah, so I'd love to start first to know a little bit more about your entrepreneurial journey. If that was something that was always on your radar, or what point in your medical career it came onto the horizon.
So I never thought I would be an entrepreneur. Since I was 7 years old, just wanted to be an orthopedic surgeon. That was my life's goal since I broke my arm twice when I was in the second grade. And all of my focus was on being a doctor, being an orthopedic surgeon. I, went to the most prestigious Ivy League schools. I graduated from the best orthopedic training, fellowship in the country. And then in my interview process, I was about, 9 months pregnant. And I interviewed for a hospital position, which, when I was training, it was just kind of the tide was turning where people would work for hospitals. You used to work for yourself or work for a group. But because of the mess that the healthcare system is, it's just so much simpler for doctors not have to take care of that administrative burden or the billing, the insurance, right? Just be a doctor. So most people were taking positions with hospital systems. And everything went great. I met the whole staff, the CEO. They offered me the position and I got the contract and it was 1 page long. And I'm like, this doesn't make sense. Why is this contract only 1 page long? And it didn't have any provisions for call. It didn't have any provisions for holidays or maternity leave or anything. And even with all that, pretty much the only thing that I asked to when I came back, with comments about the contract was, can I have in writing that I will take on average 2 weeks of call, or say 1 week of call a month, which in my previous, time at HSS, they were taking 1 week of call every 2 months. So it was, pretty, I thought reasonable request. And then the day after, I got a call from HR saying the position no longer exists. And so they rescinded the contract simply because I
Asked a question.
Wow. So I graduated with absolutely no job from the top training place in the world. I delivered my daughter the very next day on her due date. and I told my husband, I'm so sorry. I'm the most overqualified unemployed person in the world. And I had a colleague of mine who had graduated a couple years earlier than me come to visit me and the baby, and like, how are things? I'm like, they're terrible. I don't have a job. I don't have anything. And he goes, you're in a great spot. I go, what do you mean I'm in a great spot? This is awful. I have no prospects. All the jobs have already been taken, for that cycle. And he said, no, you can start your own thing. I go, I can't start my own thing. Nobody starts their own thing. It's not a thing anymore. And he goes, no, you can, sublease space from someone. Malpractice is 50% off your first year. And then it got me thinking, like, you know what? I go, this actually could be the best thing that ever happened to me. And that's how it started. It started out of necessity. I said, I deserve to be in Manhattan and I am going to stay in Manhattan, but that meant that I had to create my own position. And it's not easy. We all convene for our boards 2 years after we all graduate. And out of the 750 orthopedic surgeons, I was the only person to start a practice graduating fellowship.
Wow. And how long ago was all that?
That's 9 years ago.
Okay. So you feel like pretty confident as an entrepreneur at this point.
So, I really never, even that, I did not think of myself as an entrepreneur. I just thought I'm running my practice, right? But there's so much involved in that. There's the business side, there's marketing, just taking care of employees, my own employees. But it wasn't until COVID when I had the idea to kind of take a more creative direction with the free time that I had. The point of me starting the practice was to have the flexibility and control to do what I wanted, whether that was go to my daughter's swim practice or, drop her off at school, every day, not take call every Christmas and Thanksgiving. And so I said, well, I should take advantage of this control and flexibility. So I started a media company, and that was probably the start of what I consider being an entrepreneur, even though I had been running my own business for 8 years at that point. This was something where it was totally out of my comfort zone. I was doing TV pilots and going on social media. And then, that led to an incredible following of women who have been misdiagnosed. And that's kind of how, we were, connected through these stories of women who have just they can't figure out what's wrong with them and no one's listening to them. No one's paying attention. So I decided to create an entire new social media platform called Feel Betr to honor those stories and give women a voice, a safe and trusted place to share and receive their health information.
Yeah. And I want to dive deep on that. But first, recording this in May, which happens to be Mental Health Awareness Month, although I think it's something we need to be aware of all year round. And I'd love if you could speak a little bit to just how taxing it is mentally to not feel seen, heard, validated, understood, or just be going around from doctor to doctor without getting any answers.
So the first post that I ever made on Little Misdiagnosed, which is my TikTok handle. So
massive TikTok account. Yes.
So I had 0 followers, 0 posts. And I told the story of a woman who slid into my DMs on one of my other channels and said, I'm so sorry. I don't talk to strangers on the internet, but I am desperate. I have severe fingernail pain for 10 years. Nobody believes me. I've seen 5 doctors. They can't find anything that's wrong with me. They think I'm making it up. But it is so painful. Do you have any idea what it is? And because I couldn't help myself, I texted her back. I said, I also don't normally talk to strangers on the internet. But do you have a little blue dot under your fingernail? And she said, I do have a little blue dot under my fingernail. I said, listen, you're going to ask your doctor to get an MRI of your finger. It's going to show that you have a glomus tumor. You're going to get that glomus tumor taken out and you're going to be cured immediately. So then 1 month later, I get a message. Oh my God, Dr. Nance, I got the MRI. It showed it was a tumor. They took it out. It was a glomus tumor. I have no more pain. Thank you. Thank you. Just
endless thank you.
And I started thinking, why did it take this woman 10 years to get the answers, right? And these were 10 years of her feeling like nobody cared about her. No one listened to her. I knew what she had in 3 words, right? Severe fingernail pain.
Trying to make her feel like she's crazy.
Absolutely. So once I posted that story, and that story got 500,000 views in 24 hours, the overwhelming response was, I feel the same way. I feel like nobody's listening. I feel like nobody believes me. I feel like people are discounting my pain when I say I'm in pain. And so then I just started telling everybody else's stories of it was the same scenario over and over and over again. I went to my doctor. I was having my hair falling out and I lost 10 pounds. And he said, you're stressed. Well, turns out I had Lyme disease, right? Or I went to the ER because I was having lightheadedness and jaw pain. And they told me I was having a panic attack and I was having a heart attack, right? It was the same story of women being misdiagnosed because their symptoms were not taken seriously and they were made to feel like they were making it up.
Yeah, I'd love if you could speak a little bit, because I feel it's a stronger authority coming from somebody inside the system. Like, what are some of the systematic biases that this is way more true for women?
So the biggest problem is that 96% of all research and development has been done either on men or for male-focused diseases. So that leaves 4% for R&D for all women's causes, and 3% of that is cancer-related. So that means 1% is for everything else, okay? Endometriosis, all the autoimmune disorders,
Menopause.
migraines, okay? Okay, like you name it, it's neglected. And so not only is it that there's not enough research into how these diseases affect women, but also how the diseases present in women differently. So for example, I posted a video about the symptoms of heart attack in women and how it's different from men. And it got thousands of comments. So I asked my friend who has an AI company, I said, could you do an AI sweep of my comments and then just aggregate the most common symptoms that women described? And their symptoms, if you close your eyes and you think, who's having a heart attack, right? It's a man clutching his chest saying, I feel like an elephant is sitting on my chest. All right, what woman has ever said, I feel like an elephant is sitting on my chest? No. So we scrubbed those comments. The women who had heart attacks said that they had lightheadedness, they had nausea, they had jaw pain. Okay. And so if you go to the ER with those symptoms, heart attack is not on their radar. All right. And because of that, you're not going to get an EKG. All right. You're going to be told, take some deep breaths and go home because you're having anxiety.
Yeah.
You're having a panic attack. And so at the bare minimum, we as women have to educate ourselves on what some of these symptoms are so that we are more empowered when we go into these conversations with doctors and we are able to recognize patterns, right? You say, listen, I've seen someone else with these same things, and I think that I could have hypothyroidism, right? Sometimes, this is like a thesis that one of my mentors told me, but the eye only sees what the mind knows. And that goes for doctors as well as patients. So if your doctor does not know what POTS is, then you are never going to get diagnosed with POTS.
Yeah.
Okay. But in today's day and age, when there is so much information out there, there's no reason why we should not be able to have access to the type of information that's going to help us at least have an idea of what's going on with us.
Yeah, I think that's, one of so many reasons it's going to be so powerful. This platform that you're creating is, one, you're giving agency to the patient or to the woman in hand. And two, you're going to be arming them, if you will, with very specific information. Like in the example of the first post, I think it was so important that you told her the exact test that she should be asking for. But what's sort of like the fine line here? Because I'm sure many doctors are really sick of patients coming in with, like Googled ideas of what, like, it's so important that you're creating this curated, sort of safe, verified information for people.
So one of the problems and the issues that doctors have when people say that they've Googled things, right? When you Google something, there is no specific curation to you as a 40-year-old woman who is Googling, right? So the information that you get is based on the research that already exists, and that's for men and male diseases. So number one, it's not specific for you, the person who is searching for answers. So the answers are typically garbage, right? And similarly, if you go on to WebMD, who has spent more than 10 minutes on WebMD without thinking that they have cancer, right? That's how it goes. So a lot of the self-directed searching is not accurate. And so I understand, doctors' frustrations with patients who will come in and they will say, well, I have carpal tunnel syndrome, right? I looked it up on Google. I have carpal tunnel syndrome. Now, as a doctor, as a hand surgeon, my job is to listen to your symptoms, to examine you, and then my job is to educate you on what I think the problem is. A nerve problem in your hand, but actually you're complaining of pinky numbness, and the pinky nerve is the ulnar nerve. It's not the median nerve, and carpal tunnel is the median nerve compression. So your numbness is actually coming from the ulnar nerve, from your elbow, right? It's not to shut down the patient and say, no, you idiot, it's not carpal tunnel syndrome. It's to recognize that the patient is really concerned about a nerve problem. They've done their research. It may not be the right thing, but I would much rather have a well-educated patient come to me and have researched their symptoms so that they're more specific with the information they give me, right? The only way we're able to come up with a diagnosis is through the input that I get from asking you questions, from you telling me concerns, from the exam, that I do. So the more data points that we have, the better our diagnosis is going to be, right? If you think of, in the 1930s and in the 1940s, when the doctor would show up to your home and you would have a home visit, that doctor was spending hours with you, right? They were asking hundreds of questions. And so they had so many more data points to make a diagnosis. And now with how the medical system is set up, if you only have a 7-minute window where you have to ask questions, do the exam, come up with a diagnosis, order the tests, and then educate on what just happened, it's really not possible.
Yeah, no, it's not. So I'd love if we could focus, although I love you sort of become an expert on every female diagnosis because of your position, advocating for women. But can you speak a little bit to why autoimmune diseases, because they're so hard to diagnose in general, tend to be more prevalent in women, or is that even true?
So the statistics are that autoimmune disorders affect women at a ratio of 80 to 20. So 80% women. Okay. This is like not even a question. And what most people will tell you is if you have one autoimmune disorder, you probably have 5. Okay. And I think what that speaks to is that there is a larger issue with autoimmune as a category than just finding the lab that confirms you have psoriasis, that confirms you have endometriosis, that confirms you have Crohn's disease, right? Because you hear stories of women who have Crohn's disease, and then 5 years later they're diagnosed with colon cancer, right? So was that always Crohn's disease? Was that something that turned into something else? And so I think that there is a much larger problem going on with autoimmune that we still have not identified exactly what is going on. And I think, there's even some discussion of, we have always categorized autoimmune diseases as the body attacking itself.
Mm-hmm.
Well, what if it's not the body attacking itself, right? What if it's a virus that our body is responding to, but we just never isolated the virus, right? And so there's no clear-cut explanation right now as to what exactly is causing a lot of these autoimmune disorders. A lot of the autoimmune disorders get triggered after post-viral incidents. That's why a lot of people who have long COVID or other, post-viral problems, the autoimmune disorders tend to pop up after they've had, a viral illness. So I think this is a perfect example of an area that needs so much more dedicated research to understand what the problem is, why is it affecting women at these insanely disproportionate rates. Okay. Yeah. And so that's we need more research. In order to do more research, we need more funding. To get more funding, we need more attention. We need more visibility. And that's where platforms like social media, where people are talking about it more and more and more, that's the start. And I'm a big proponent of women learning from other women who have similar diseases and problems. And another one of my thesis is, if you have endometriosis, there is no one you trust more than someone else who has endometriosis. And I think that we can learn so much about the natural progression of disease from others, because no two stories are the same. No two disease, patterns are the same. But I think that at least the starting point is recognizing that it's not normal to have pain all the time. It's not normal to feel exhausted all day long. And we have to recognize that these are problems. They're not moral shortcomings, right? Mm-hmm. It's not, like I can't believe I'm still tired today, or I don't understand like why I have this headache. I wasn't drinking enough water. I wasn't, we tend to blame ourselves more than look for the external problem that is affecting us.
Yeah. Can you share a little bit more about how the community aspect, you kind of talked about on it right there, but how are women going to connect exactly on the platform?
So for our platform, the very start is everyone is in the same boat. Everyone is on the platform because I believe that there is so much cross-pollination that happens when you talk purely about symptoms and not necessarily diseases, right? A lot of the health information is siloed by disease. So you may have fatigue because you have POTS, but someone else may have fatigue because they have Lyme disease. And there's a lot of good tips and techniques that can be learned from one another. So really the common thread for everyone on the platform is that they have some ongoing health issue that they want to learn more about. They want to connect with someone else who understands what it's like to live every day with something that affects them on a physical level, on a mental level, on an emotional level, right? That feeling of nobody listening to you is the same for someone who's had undiagnosed endometriosis for 10 years, undiagnosed Lyme disease for 10 years, undiagnosed breast cancer for 5 years, right? So we have much more in common than we think. And so the point of this platform is to bring people together in that spirit of finding the commonalities and then helping one another and recognizing kind of patterns of symptoms that may help you be more empowered to speak with your doctor.
Yeah. Well, I'm excited. I'm on the wait list. Is there any other way that you want to call people in to work, to connect with you or to sign up for the wait list? What's the best way? Obviously, they should follow you on TikTok.
Yeah, certainly the best way. Well, the reason why I started the platform is because I'm not sure how many of your listeners are on TikTok or are TikTok users.
Yeah, I
But
had to
TikTok
download
is a
it
bit,
again, by the way,
yeah,
even to follow you, but I'm happy I did.
yeah. I mean, and who knows, TikTok may be gone in a year anyway. But how TikTok works is that if you are a follower, you do not automatically see content from the people that you follow. So it's the reason why we had to create this separate platform is so that we would be able to curate content based on what you need and what you are searching for. So if you log onto our platform and you say, I'm 40 years old, I've had a diagnosis of hypothyroidism, I'm having problems with fatigue and weight gain and hair loss, you will be able to then have content curated, right? So that you can not only consume medical information that's valuable to you, but then also find your community of people who are also dealing with those same issues. So certainly you can watch me on Little Misdiagnosed, sign up for Feel Better at feelbetter.health. And really what I recommend is just talk to your friends, share your stories, because you never know who is listening and what piece of information that you shared could be valuable, not only to that person, but to someone that they know, right? Like they've heard like, oh, you know what? My friend kind of has been complaining of these crazy periods ever since she got, this shot, or, my friend's been complaining of like, pain under her arm, and you don't know what like domino effect you can have. And so I'm really a proponent of sharing our health stories so that if you can help one person, it is worth it.
Yes, I love that. And it's a safer space, right? I mean, I think that's a key element, particularly for women, just feeling like it's a safer platform to share all of their details. I'd love if you could end by sharing some of your sort of non-negotiable wellness health practices that you like to thread into your life?
Oh, these are more wishful thinking, but I do. You know what? I prioritize mixing a lot of things. So I do tennis with my girlfriends, right? Because I don't have time to spend an hour exercising and spending an hour going out to dinner, with everyone. So we do tennis social, once a week, Tuesday nights, and I don't schedule meetings for that time. That's that's my sacred time where I'm able to get exercise in and, for my own sanity, talk to friends. Similarly, I block out times. I take my daughter to school every day, except for Wednesdays, my office days, but that is a non-negotiable. I do not schedule calls or meetings during that time. And I get more out of that 45-minute walk, with her than she, appreciates at this age. But it's just a moment of one-on-one connection with your loved ones. And we could be singing the score to Hamilton. We could be talking about quizzing her spelling test that's coming up. It doesn't really matter what the topic of conversation is. It's just that we are present for one another in that moment.
Yeah. And walking. So bonus.
And a bonus and walking. Exactly.
Yeah. I love that layered approach. Very, very intentional and brilliant and necessary. Let's face it. That's how these things get thread in, is being intentional and seeing how you can overlap. So is there anything else you want to share with us, Erin, before we wrap up? I'm so excited for this, and I really appreciate you taking time out of your busy day to do this.
Oh, of course. I really see our generation as intentionally having a confluence of health and wellness. Whereas before it was doctor, medicine, health, and functional medicine, wellness, fitness, beauty. And I see it as completely one, spectrum. And that there may be points in time where, you need aortic valve replacement. Okay. Yes. Your surgeon is going to do that. But there's so much else that we don't have to discount the other side, right? I strongly believe that doctors have so much to learn from people who are experts in the wellness industry. I think the people who are in the wellness industry, have a deference to doctors that's probably maybe not even so deserving. And so I really see our generation as breaking down that barrier and understanding that you can treat your hypothyroid with pharmacologics and with, meditation practices and, nutrition guidance. And that if we really honor a holistic approach, that means that we need both sides to work together.
Yes. Woo! Say it louder for the people in the back.
Yeah.
Totally agree. Well, thank you for ending on that high note. And, I look forward to being in touch, and we'll share all the links. And I hope you have a beautiful tennis match the next time with your girlfriends.
Amazing. Thanks, Megan. This was great.
Thanks.
Bye.
Hey there. One last thing I wanted to share with you. If you're enjoying this podcast, it would mean so much to me if you could rate and review it on your favorite podcast platform. It really does help us grow the show. And this being So important to me to get this message out to more women to help them optimize their wellness and ultimately their lives. This is my mission, and I would greatly appreciate it if you could support the podcast by rating and reviewing. Thanks in advance. Have a good one.